A 55-year-old male patient, Mr. Perry, is brought to the emergency unit by the paramedics. He is a known hypertensive and diabetic. However, he is uncontrolled. He's been our regular patient for some time, reason being that he is known with multiple injuries which are associated with overindulgence in alcohol. He complained of weakness in his arm and leg and also difficulty in speaking. This time around, I knew that there was something wrong with him. It was not alcohol related, especially when I saw the weakness on his face. What is wrong with Mr. Perry? Hi, you are watching ED Files, and I am Dr. Thabo Mafa. Did you know that globally, a stroke is one of the leading causes of disability and death? And the World Health Organization mentions to us that about 10% of the deaths that we see globally are related to stroke. And what is a stroke? A stroke is a sudden interruption of blood circulation to the brain tissue. And this would result in inadequate oxygenation, and also the nutrients won't be able to go to the brain itself. This can easily result in cell death of the brain. Whenever we talk about stroke, we usually refer to two types of stroke. And the first one on the list is ischemic stroke. This simply means that there is a blockage or occlusion of a vessel, therefore leading to inadequate blood supply to the brain. The next one is a hemorrhagic stroke. This usually happens whenever there is a bleed. It could be a small vessel that has burst in the head and resulting in inadequate blood supply to the brain. And did you know that an ischemic stroke in most cases is not as fatal as the hemorrhagic stroke? Probably you are wondering what could cause an ischemic stroke. You could have a vessel that has got plugs in it, and these plugs would occlude the lumen of the vessel, and it won't be able to transport blood to the brain. And secondly, you could have a patient with an abnormal heart rhythm, and this would lead to some blood being left in the chambers of the heart, and they would form clots in them. These clots can easily be shot straight to the brain, and this is called cardioembolism. You can also have a small vessel occlusion, and sometimes the cause for the stroke is unknown. And now, Mr. Perry, what symptoms did he have? He presented with a slurred speech. This is an unclear speech you would hear when a patient has lost coordination when they try to articulate. And he also had weakness of his right arm and leg. And the family also mentioned to me, and even on observing him, that he's got facial weakness on one side, and that was the right side. They also mentioned that he also complained of dizziness prior to this. And with the other symptoms, especially in a patient with a bleed, this is called subarachnoid bleed, they usually complain of a severe headache that is persisting. When we examined Mr. Perry, even though he was fully awake, conscious, we noted that his blood pressure was very high, about 205, 110. And on average, an adult would have about 120, 80, just an average. His heart rate was not much of a problem. it was 90 beats per minute, which is within normal ranges. His oxygen saturation and his temperature were within normal limits. Remember, we mentioned that he is a known diabetic who was uncontrolled, together with hypertension also. And that would explain why he had such a high blood pressure. And his sugar levels were sitting at 17. On further neurological examination, Mr. Perry had weakness of his limb, both the right arm and the leg. He also had dysphasia. And what is it? This is difficulty finding the right words you want to say when you speak. Together with that, there was dysarthria, and this is characterized by mumbling or an unclear speech. However, with the signs that we already got in Mr. Perry, other patients can have other signs as well. You can have a patient coming in with an abnormal eye movement, and this is nystagmus. This is characterized by a patient who's trying to follow an object without turning their head. Their eyes would be making a movement that's quite abnormal, and it's rapid, especially when they go sideways or upwards. And also, they can have what we call a hemiparetic gait. This simply means that due to the fact that there is loss of power in one limb on one side, they lose balance or strength to be able to give it a good balance or support. So that is a hemiparetic gait. Last but not least, a patient may have ataxia. And this is a condition whereby there are involuntary movements, especially when they try to reach out for an object. Whenever we see a patient with symptoms and signs that look like a stroke, it doesn't always mean that definitely it's a stroke. There are conditions that can look like a stroke or mimic a stroke. And the first on the list that is very common is low sugar levels, that is hypoglycemia. And a patient who recently had a seizure, they are in the post-ictal state. They can look like someone who has had a stroke. Thirdly, you can have a patient who presents with what we call a Bell's palsy. And that would usually present with one-sided facial weakness. But this one doesn't affect the limbs. And you can have other conditions as well that may look like a stroke. A patient who presents with acute confusion, sometimes it may be difficult to know if it's stroke related or if it's not a stroke at all. And a patient who's got a brain tumor or a growth in the brain, they may present as if they've got a stroke. But in this case, the symptoms and the signs are very gradual. It's not of a sudden onset. What patients are more likely to have a stroke, or what are the risk factors? Age is one of the factors we need to consider. A patient who is older, it could be 50 and above or 60 and above. The more the age is advanced, the more the risk. The other risk factor of note is high blood pressure or hypertension, and together with diabetes. The reason being that high blood pressures can increase pressures within your vessels, even the vessels that you find in your head, and that can easily result in a stroke. Diabetes, in most cases, especially if it is not being controlled, can cause abnormal metabolism of your cholesterol and sugar, and this would form plaques within the vessels and occlude these vessels. A patient with chronic kidney disease is also at risk. A patient with obesity is also at risk of having a stroke, and they are also at risk of having both hypertension and diabetes. They may also have difficulty breathing whenever they are sleeping, and this is called sleep apnea, and this is one of the risk factors for a stroke. A patient who smokes heavily, they can easily clog up their vessels, and this can result in a stroke. If you've got a heart that has an abnormal rhythm or quivering of the chambers, like in a case of atrial fibrillation, you can easily form clots in your chambers and dislodge it to your brain. If there is sickle cell disease, whereby the red cells are quite abnormal and they clump easily, this can easily form clots. This one in particular goes out to people within the childbearing age who are on family planning. Females who are on oral contraceptives are more likely to have their blood thickened and forming clots, and this can cause a stroke. And furthermore, this can cause clots within the lungs. Now that we have had the symptoms and the signs that we found in Mr. Perry, the question is, how do you investigate him? How do you make sure that this is definitely a stroke? A patient who presents to the emergency unit with stroke-like symptoms, you have to send them for a scan as soon as possible, immediately when they get to the unit. You can do a non-contrast scan or an MRI scan depending on your level of suspicion or what is it that you're looking for. However, in some cases, you could find that a patient has got the typical clinical signs of a stroke, but the radiological images are not able to pick it up. In a case like that one, you still have to consider it as a possible stroke and treat accordingly. In a patient who's got the typical signs of a stroke, and in this case, you are suspecting a bleed in the brain, but the images that you see on a scan are clear, you can go ahead and do a lumbar puncture. This is done by taking a sterile needle at the lower back. You put it in and you test the fluid that covers your brain or that flows around your brain, just to check if there is any evidence of blood. If there is, it means most likely the patient is bleeding from the brain. And you remember that we talked about other conditions that can look like a stroke. This simply means that when you investigate these patients, you need to investigate extensively. You have to do bloods also. You have to check if the infection markers or the markers that show inflammation are within the normal range or they are raised. Because a patient who presents with headache and vomiting, with infection markers that are very high, that could mean something else like meningitis. And also, you need to do your ECGs to look at the rhythm of your heart. And lastly, you can also do chest x-rays. How do you then treat Mr. Perry? This is a multidisciplinary kind of approach when you look at a patient with a stroke. It means that you are going to need more than one healthcare professional. You're going to need the nurses to be able to monitor this patient 24 hours. You are going to need a neurologist who is going to assess the brain activity or the status of functionality of this patient. In a case whereby a severe bleed has been confirmed on the scans, you may have to call a neurosurgeon to have a look at this patient. Furthermore, you also need a speech therapist, you need a physiotherapist, and also an occupational therapist. In a case whereby you have confirmed that this is a stroke due to blockage or an occlusion of a vessel, you may have to opt for medication that would break down the clot, and this is TPA. Or alternatively, some surgeons would prefer taking the patient straight to theater to remove the clot manually. And a patient who has had a stroke, as you can imagine, this is a sudden change in their lives. But the question remains, what is next? What could possibly go wrong after having a stroke? And these are the complications. A patient might start having seizures, or they can have cognitive impairment. This simply means that their functionality in terms of reasoning and understanding certain concepts might be impacted heavily. They can have speech difficulties, and those who are sitting on wheelchairs, especially for too long, they can have pressure sores, and these sores can be uncomfortable for the patient, and they may even go septic sometimes. And now, the moment you have been waiting for, what eventually happened to Mr. Perry? He was stabilized in the emergency unit, and soon after that, the specialists took him to ICU, where he made significant recovery. A few days later, even though he had residual symptoms of a stroke, he had started speaking more fluently, and also he started moving his limbs much better. In conclusion, early recognition of the signs and symptoms of a stroke and commencement of treatment as soon as possible can save lives. And thank you for watching.